What I miss is being out there, coming through the gate and getting ready to play. I missed the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season, and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you, because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine was felt like a hero walk. And I feel that everyone who is going to receive the vaccine is going to get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle though.
Residents have now received their first dose of COVID vaccine. Nearly 58,000 have now received their second dose and would be considered fully vaccinated. As our vaccine numbers continue to go up each and every day, the number of new cases in Saskatchewan does continue to decrease. Our 7-day average in the province is now 139. That's down by more than half of where we were at the peak of the third wave of 286 on April the 15th. In fact, it's down about 26% in the last week alone, very much a positive. Vaccines are making a huge difference in our province, and that's why we are confident as we move forward with our reopening roadmap as we continue to reach the vaccination targets that are set out before us. Step 1, as we had announced, begins this Sunday, May the 30th, and yesterday we achieved our threshold for Step 2, which is 70% of everyone over the age of 30. And which have now received their first shot. So this means that Step 2 will begin on June the 20th. And that also happens to be the first day of summer, and I think it's going to be a great summer in Saskatchewan. As more people continue to get vaccinated and things start to get back to normal in our great province. One part of a great Saskatchewan summer is that all of the outdoor sports and the sports leagues that we have in this province, softball, baseball, football, soccer, and such. And I was very happy to announce earlier this morning that those outdoor sports will now move from Step 2 into Step 1, which means they can begin this Sunday. We are only able to do this because the risk of transmission obviously is lower outdoors than it is indoors. But the main reason that we are able to do this is because so many Saskatchewan residents have done their part. They have went out and they have gotten vaccinated. And in doing so, they are reducing the spread of COVID in our communities. So things are moving ahead. They continue to move ahead, but we still do have a ways to go. We are now at 63% of all adults in Saskatchewan have now received their first shot, When we reach 70%, we would then move forward with step 3 of our reopening. But we can't even stop there. We need to get as many people vaccinated as possible, and we need to make sure then that all of those same Saskatchewan residents go back and receive their second shot, so that we all are fully vaccinated and fully protected against this virus. Almost everyone will have a chance to get their second shot by sometime in July, and surely we'll have that opportunity by the end of July. And at that point, really the only unvaccinated people in our province will be those who have made a conscious choice, those that have chosen to not be vaccinated. And I want to just speak directly to those individuals for a moment. You should know, and you should be fully aware of the risks that are associated with your decision. Even though we are reopening in Saskatchewan, COVID is not disappearing. COVID will not be gone. And those who have chosen to not get vaccinated, you will continue to be at risk at not only contracting COVID, but at risk of much more severe outcomes. I know that some of you are making this choice and are also encouraging others to maybe not get vaccinated. This is under some misguided notion of defending your personal freedoms. But here's the thing. You're actually the ones that are standing in the way. I know it's a bizarre misconception that politicians like myself and others, that we love imposing these restrictions on people and the general population. And I can tell you today, nothing could be further from the truth. I hate it, and I look forward to the day that it all ends. But that day can only come when enough of us choose to be vaccinated. So if you really want all your freedoms back, go get in line and get vaccinated. It's really not that big of a deal. We're not asking you to storm the beaches of Normandy. All we're asking you to do is to go in and to get a tiny needle in your arm. Every day, thousands of people all around the world are working very hard to develop and produce safe and effective vaccines for all of us to have access to. Vaccines that have saved, are saving, and continue to save the lives of people that these folks actually will never meet. Here in our province of Saskatchewan, thousands of healthcare workers are administering those vaccines, and they are saving the lives of Saskatchewan people, again, people that these guys had never met. They're saving, and hundreds of thousands of your fellow Saskatchewan citizens continue to do their part. They continue to go out and get vaccinated. And they are saving the lives of people that they in turn also will never meet. So to all of those that choose to not get vaccinated, or to those that may campaign for others to not get vaccinated, I want you to know that every one of those people values their freedoms, and they want those restrictions gone just as much as you do. But here's the difference. They're actually doing something about it. They're going out and getting vaccinated. They're doing their part to protect one another and to make sure that we can safely remove these restrictions and restore the freedoms that we all truly value. We're all going out and getting vaccinated. It seems ridiculous that I even have to sit here and mention this, but I guess I do. Vaccines work. Vaccines eradicated smallpox. Vaccines eradicated polio. And vaccines will greatly decrease fatalities from COVID-19 so long as enough of us go out and receive them. So if you truly want all of the restrictions removed and all of your personal freedoms restored, then I would ask you to do your part. Get vaccinated. And the good news is, in this province and across this nation, the overwhelming majority of Saskatchewan people are making the right choice. They are getting vaccinated, so let's keep it going. Every Saskatchewan resident age 12 or older now is now eligible, so if you haven't done so already, please go get your first shot. And when it's your turn, I would ask you then to go get your second shot. It's how we will protect ourselves and continue to protect those around us. It's how we will get everything reopened and back to normal in our communities, and it's how we can all have a great Saskatchewan summer. Let's all do our part, and let's all stick it to COVID. Dr. Shahab, do you have some opening comments?
Thank you, Premier. So I'll just maybe re-emphasize a few points, Premier, that you made. That the Saskatchewan reopening plan is very aggressive, but it's very thoughtful, and it really hinges on two things. One, all the hard work we have done, all of us, following the public health measures to bring our case numbers down. Our case numbers are around 11 per 100,000 now. Test positivity is just over 5%. So we have done really well, and our testing rates remain high. So a lot of these public health measures are being relaxed in step 1 and later in step 2. But I would urge all of us to go to the website, read the details of everything in the Reopen Saskatchewan plan under step 1, so that as we enter step 1, as we can do more things confidently and safely, we do follow the guidelines, because as the Premier said, we still have a ways to go. Our vaccine uptake has been fantastic. It has meant that more and more people are protected with one dose and now increasingly second dose, but we do have a ways to go. We need to make sure that we focus and finish with all those remaining, especially under 40, get vaccinated. All those remaining older than 40 obviously get vaccinated with the first dose, and of course, as we become eligible with the second dose over the next 4 to 6 weeks, 8 weeks, because that is going to be critical. The higher our vaccine uptake, first dose and then second dose, the safer our reopening steps 1 and 2 will be, and the more ambitious our step 3 reopening plan will be. So I think it is critical that we both get vaccinated at our first opportunity and look at all the options available, SHA run clinics, pharmacies, look around at any options that are closer to us or not so close to us, and get that first dose and then that second dose as we become eligible. And of course, for first dose, everyone 12 and older is now eligible. But that still comply with the few measures that will remain till such time that we have reached a stage where we can be even more ambitious. And I just reiterate that we saw again in our second wave, when vaccines were not available, that many younger people actually got hospitalized in ICU, spent many weeks in ICU, and unfortunately died. We also saw with vaccination programs how it is now rare to see someone with even one dose get seriously ill. And unfortunately, we continue to see individuals who may not have been able to get a vaccine still get seriously ill in Saskatchewan and get hospitalized. And we would all like that to be a rare event in Saskatchewan. And I'll just close off by saying, what a privilege it is to be in Saskatchewan, in Canada, where we can actually get a vaccine, a safe and effective vaccine for everyone 12 and older, where in many parts of the world, even healthcare workers have poor access to vaccines, even the elderly have poor access to vaccines. So I think we should, really take advantage of this great privilege and complete our vaccine program over the next, 6 to 8 weeks. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll take questions and we'll start in the room. Murray?
Sure, thanks. Mr. Premier, I think it's fair to say you were stronger, more adamant in your direct response to people not getting vaccinated. I guess I'd like to know what's prompted this. Is it because we do see a bit of a slowing in the 30 to 40 and under 30 age group, and that there is this worry that we might have hit a wall?
No, not necessarily a concern of any particular age group or even the fact that we've hit a wall. The vaccine uptake in Saskatchewan has been quite strong in all age groups, and I think it will continue to be strong in the days and in the weeks ahead. That being said, we need as many people vaccinated as we can possibly get in this province. There's no reason why it shouldn't be extremely strong to the point of virtually everyone making that choice. We were discussing earlier, and Scott, you might have a little bit to add just on the vaccine uptake, maybe in particular in some of the younger age groups that have just become available more recently. And Dr. Shahab had mentioned this in his opening comments. As we move forward now with vaccines available to everyone of all ages, 12 and up. Today we have 136 people in the hospital. The vast majority of those people, virtually all of those people, for one reason or another, some may not have been available at that point in time, or some may have made a conscious choice to not be vaccinated. The risk of making that choice as we move forward, as the choice is now yours, the vaccines are available to everyone over the age of 12, is great, and people should understand exactly what that risk is. The risk is that you may get sick, you may end up in a hospital, as we say, the vast majority of people that do end up in our hospitals are people that have not been able either to access a vaccine or, to this point, been able to access a vaccine or been able to, or made a choice to not be vaccinated. In the days ahead, there's only one group of those people that will be available, those that make a conscious choice to not be vaccinated. And I would ask people to take that decision very, very seriously. Not only is this the path to lead our communities and our life back to normal, but it's also the path to ensure your own personal safety from this virus. But Scott, do you want to speak just a little bit, because there might be some interesting data on some of the uptake on vaccines, in particular with the younger age groups?
Sure. So Murray, I'd just like to start off by saying the single biggest rate-limiting factor for the immunization program isn't the desire for Saskatchewan residents to become vaccinated. I believe it's the supply of the vaccine, and we've talked about this a lot. And if supplies were there, I believe truly that we'd be a lot farther ahead than we are today, both on first and second doses. But just to address some of the things that have happened literally over the last couple of weeks since May 11th, we have over 12,295 kids between the age of 12 and 17 vaccinated. That started last week. In the 18 to 29-year-olds, it's gone up 23% in that last 2 weeks. So again, I don't think that's an indication that it's stalled. 30 to 39-year-olds gone up 23% in the last 2 weeks. Again, I don't think that's an indication it's stalled. And then the last comment I would make is we are continually looking at different options to bring vaccines to communities and hard-to-reach groups. Some good examples of that is the clinics, both Saskatoon and Regina and elsewhere in the province, where we're focusing on new Canadians, trying to bring down some of those barriers or lack of understanding what the vaccine really does. And moving, frankly, the most definitive tool we have to get ourselves out of this pandemic forward in the province. And we will continue to do so as we move into schools next week with our school age program.
Follow up, Murray?
If that is the case, should the program to have educated people, and particularly politically educated, because respecting what Mr. Livingston's said, a lot of it is also driven by a philosophical nature, and people deciding that they're not going to get vaccinated, along with the new Canadians and other people that just don't have access to it. In both cases, both situations would be somewhat averted had there been a better education program in terms of what the vaccine should be doing and why we should have been doing. Should we not have been doing that, I guess, a month ago or maybe longer, saying, look, this is how crucial it is. The message has gotten out to those of us paying close attention, but it does seem that it's quite possible it's either being ignored by groups that have discovered that they have some momentum to oppose vaccines, or it's not getting down to the roots of people that haven't been tuned into the message.
Yeah, I actually I disagree a little bit with the premise of the question, Murray. I think the vaccine uptake in Saskatchewan has been very strong across the age groups. Can it be stronger? Sure. But I think it's been as strong as virtually any. I'm not aware of anywhere in Canada or really around the world where it has been stronger. Now, as we receive larger amounts of vaccine, we'll know where ultimately that will ultimately plateau out. But throughout the vaccination campaign, we've been very focused on not only providing education, but also to people of Saskatchewan about the vaccines, but also providing even the incentive ultimately to get vaccinated. But we have an advertising program that we've invested in, as we know. It includes billboards, it includes television advertising, as well as online and radio. We have tied our entire reopening plan to the levels of vaccination that Saskatchewan people will ultimately choose to uptake, and we've hit phase 2 or step 2 of that plan as recent as a day or two ago. So people are taking to the vaccines, and they are choosing to be vaccinated here in Saskatchewan at what I think are very strong levels, and I view it as a strong response to the measures ultimately that we've had to deal with over the course of the past year, not just here in this province, but across the nation. And I would say the response and the uptake of vaccines in Saskatchewan has been as strong as anywhere that I've seen across the nation. So hats off to Saskatchewan people for what they've done. I think what you're seeing here today is an acknowledgement that we're not finished. We have some more work to do, all of us, in particular those of us that are maybe on the fence with respect to whether or not we should take the vaccine, maybe on the fence as to when we ultimately might make that appointment. And I would urge you to get off the fence. I would urge you to understand what the risks of you not being vaccinated are. And the risks are potentially fairly severe outcomes from this virus. We have a protection mechanism, a larger protection mechanism in place now than we've ever had, and that's access to vaccines. So if you're 12 and over, your time for a decision is now.
We'll take another question in the room.
Dr. Shahab, did you want to add to that?
Yeah, if I could just add to that, the 3 C's of vaccine uptake, one is convenience. So obviously, many people have commented that Saskatchewan has been one of the easiest places to get vaccinated in Saskatchewan. But even as we move forward, it's important to know what your options are, what your family's options are. Is there a drive-through, a pharmacy, an SHA clinic, a physician's office? Because I think it is very convenient, but there may be some changes that may happen. So many people are very savvy, and they're able to let their friends and family know where vaccines are available. So convenience has never been better in Saskatchewan, but it's just being aware of as supplies and providers change, just being aware of what's available near you and sharing that with friends and family. Second is complacency, that sometimes, so in Saskatchewan you can go and get time off from work and get vaccinated, but some people may put it off for a bit, that I'll think about it next week, or so forth, or case numbers are coming down. So again, complacency is not time is not on our side. There's no reason why we couldn't have seen a surge similar to other provinces, or can't still see a surge as we reopen if our vaccine uptake remains lower, especially in younger populations who are more likely to be socially active, out and about. So there's no room for complacency. So again, finding that time at your earliest convenience, at work, after work, weekends, I think is going to be critical. And finally, vaccine confidence. The other flip side of that is hesitancy. Why are you hesitant? Having that discussion with friends and family, with the pharmacist, with your healthcare provider, physician, nurse, I think it's really important. No question is too silly to ask. Whatever your questions are, talk to a trusted healthcare provider, go to a recommended website. There are links on the Saskatchewan COVID.ca website as well. But I think all 3 elements are critical and play a role in certain populations having a lower uptake. But we really have to address all 3 collectively. Thank you.
We'll take our next question in the room. Colton?
Will this introduction of sports coming back, will that include contact sports, and any concerns about players coming into contact with each other?
Dr. Shahab, do you have on contact sports, be football and such?
Yeah, generally, what we've learned is that outdoors, obviously sometimes contact is unavoidable, but we all know the drill. Don't go and play if you're unwell. Again, we expect everyone 12 and older to get vaccinated over the coming days and weeks. Outdoors is better than indoors. And again, a lot of the risk really is pre-game, post-game, carpooling if you're unvaccinated, sharing items back and forth. Actual transmission outdoors during play, the risk is much lower. But again, it's one of those things, as our transmission rates come down at a community level, as our vaccination rates come up, certainly outdoor activities like sports becomes possible and encouraged. It's a great time to be outdoors. But obviously all the other things for the time being we have to be aware of till such time that all of us 12 and older are vaccinated with 2 doses. And it's really not transmission risk during play. It's really some of the meet and greet that may happen before or after, where until such time that everyone isn't vaccinated, there can be transmission risk. So just being aware of that. Thank you.
Follow up?
Just for step 2, why limit indoor public gatherings but not limit the capacity at bars and restaurants?
Dr. Shahab?
Why limit? Yeah, so I think, while we are looking forward to a very ambitious step 3, whenever and whatever that may be, we still have to move towards it in a systematic way. And, so we are expanding indoor and outdoor private gatherings. If you remember, we haven't been able to have people in our homes for a long time, many months. There's a brief period when it was allowed, but then case numbers started rising up. So having people, even indoors in our homes, but ideally, having that discussion, no one should have any symptoms. Preferably, everyone should be vaccinated, 12 and over, if that's possible. Otherwise, meet outdoors for the time being. In public gatherings, indoors, going up to 30 right now, and then going up to 150 as step 2. But again, till such time that we have a high vaccine uptake, first dose and increasing uptake second dose, and are able to enter step 3. Still some caution around indoor public gatherings as well. We're increasing the size, but we all need to do our part to be careful and avoid as much as we can, super spreader events. Obviously, we'll see the odd transmission clusters, and they'll be more likely, unfortunately, in groups getting together who are unvaccinated or within that 2-week period after your first dose. But I think we need to do our part so that we may see the odd small cluster, but we don't want to see large super spreader events, and we don't want to see our case number surge up. So we are moving in a cautious methodological way, and we still have to follow all the guidelines in step 1 and then in step 2 for all indoor gatherings till such time that our case numbers are low enough, our vaccination rates are high enough for us to think beyond step 2. Thank you.
We'll take another question in the room. Lisa?
Just a few weeks ago, both you, Mr. Premier, and Dr. Shahab, you were pretty confident about using Pfizer for second doses for people who'd gotten AstraZeneca for their first dose. Dr. Shahab said he expected most of the second doses in the province to be Moderna and Pfizer, but now it seems like there's a lot less confidence there and really on any second doses for AstraZeneca. So what changed in the interim between those two?
Dr. Shahab on second dose AstraZeneca, Pfizer.
Yeah, so maybe I'll tell you what we know at the present time, and then what further information we are awaiting. So at the present time, we know that the optimum time for second dose AstraZeneca is 12 weeks. For Pfizer and Moderna, we could give it any time up to 16 weeks. No one has to wait 16 weeks. People are getting it at 80 and 91 days or 13 weeks. And that timeline may get compressed based on supply and demand. But for AstraZeneca, the optimum time for the second dose is 12 weeks. So we still have a week or 2 to go because AstraZeneca first doses started in Saskatchewan in mid-March. The second thing we know is that while there was the rare signal of vaccine-induced thrombocytopenic thrombosis with and the rate is now currently around 1 in 50,000. And we also had a case who has recovered, and Canada reported around 24 cases or so. We know that with second doses, the incidence rate may be lower. So there's good evidence now to support second doses with AstraZeneca. We have supply available up to 20,000 doses at present, more in the pipeline. So there will be AstraZeneca available for second doses. And thirdly, for people who may have some concerns or who may be of a younger age, we are still waiting for some guidance based on the UK studies and other studies that are happening, where they have already shown that a second dose Pfizer is safe, but we are still awaiting some immunology data. We may not show real-world effectiveness data. We may not see that right away, but certainly as a proxy, we are waiting for some antibody data to see if a second dose Pfizer does mount an immune response as good as a second dose AstraZeneca. But certainly we expect that starting in a week or 2, as people reach the 12-week mark for the second doses, choosing to have AstraZeneca as a second dose would be perfectly fine. But we still need some more information to see if, for those who may want a second dose Pfizer, if that's as good as a second dose AstraZeneca or not. But certainly, and I'll close by saying that the UK also released data on both AstraZeneca and Pfizer. There's the 2 main vaccines that they used, 95% protection against serious illness and hospitalizations. So both vaccines extremely protective against serious outcomes. Thank you.
Scott, you may want to comment just on the fact that we do have some AstraZeneca that has arrived and what the future looks like for deliveries of AstraZeneca, but I think people should know that either way, there's a little bit of science yet to be clarified as we move forward with this, but either way, Saskatchewan residents will be offered the a safe and very effective vaccine, as well as not just on their first dose, but also with their second dose. But Scott, if you want to speak a little bit to the supplies that you have and what you foresee.
Yep. So we, as Dr. Shahab has pointed out, we do have AstraZeneca vaccine in province. We are waiting for that 12-week window for the majority of residents who receive that, and that started with Regina drive-through, our very first drive-through. But we also are opening up AstraZeneca second doses to some immunocompromised and vulnerable individuals that have been notified by letter that they will get their doses a little earlier. And again, if more vaccine, AstraZeneca is required, we are assured that we likely will get that and use it for second doses. But after, as Dr. Shahab said, as the evidence emerges, we will consider using other vaccines as a second dose. But right now, as Dr. Shahab has clearly said, it's AstraZeneca for second doses if you've received it on their first.
Follow up, Lisa?
So you're saying that people who got AstraZeneca will be able to get AstraZeneca for their second dose when they get to that 12-week mark? I mean, there are people getting to 9 weeks who are worried because they don't know what's going to happen in a couple weeks.
I would say they shouldn't worry. Scott, we do have some on hand. Those people that would be getting close to 9 weeks would be the first 15,000 AstraZeneca that we ran through Regina, and we do have those vaccines on hand. We'll be making them available as we get close to the 12-week point. The 12-week matters. Dr. Shahab, you might want to comment on the efficacy of having the second dose at the 12-week mark. And Scott, I don't know if you had any more comments on making the vaccines that we do have in stock available for those folks. They will receive their vaccine in the appropriate time period.
Yeah. So for the second dose, the proud monograph says AstraZeneca can be given anytime from 4 weeks to 12 weeks. But detailed studies, primarily in the UK and also in several provinces of Canada, has shown that while the efficacy in the clinical trials of AstraZeneca was slightly lower than the mRNA vaccines, but if you wait 12 weeks for the second dose, the efficacy is much higher at 80%. And so it starts approaching the efficacy of the mRNA vaccines. So that's why waiting for that extra week or two that still remains, waiting for that 12 weeks is really important for long-term protection, because the aim of focus and finish, the aim of 2 doses is we're not just looking at the spring and the summer. We want to see a COVID-free fall, and that's why getting AstraZeneca at the optimum 12 weeks will be ideal and preferable, as well as, of course, getting either Pfizer or Moderna, if that is your first dose, as soon as you become eligible, which will be a more compressed timeline. Thank you.
You have the doses, you're just not offering them until 12 weeks.
Yeah, Scott, we do have 20,000 roughly on hand now.
Yeah, they're just over 20,000, and when we start that, and as we pointed out already, Lisa, it would start with that group from Regina that went through the AstraZeneca drive-through that week of March 16th, 18th, and that's the other thing to remember is we're not using AstraZeneca as a first dose strategy anymore, so we're not stockpiling AstraZeneca doses in the province to give as first doses, so we're using it as a second dose strategy moving forward.
So they'll be among the first. Those folks will be among the first to receive their second dose in the province.
We'll take another question in the room. Adam?
What was behind the decision to move the timeline on sports up? Because the conditions hadn't changed from the reasons it was pushed to step 2. So what was the reason? What prompted that change to be made starting on Sunday?
Because I think when the outdoors, well, I'll speak just a little bit. When the outdoor sports is safe, and I'd spoken to this, is safer than more certainly indoors, and we haven't moved on indoor sporting activities. But the larger reason, and this shouldn't be discounted, is the fact that our children or youth, and I consider youth like 0 to 30 years old, have really sacrificed a lot throughout this pandemic. And they haven't had the opportunity for going into their second year now to play competitive sports, whether it be softball, soccer, football, whatever that might be. And we most certainly, it's among the highest priority to reduce the impacts of this pandemic on our youth, on our children. And by request of many people in conversations that I have had, as well as multiple, I'm sure, public health officials have had as well. We felt it was safe to move with respect to this at this time of year. Our numbers continue to decrease. Our hospitalizations are much lower than they were just a short while ago, and our vaccinations continue to increase. And so we still have some work left to do. Very positive numbers on the 12 and over age group that is lined up to get their vaccines in the early days. Still have some work to do, but most certainly we're on a good path and a good trajectory. Dr. Shahab, do you want to speak a little bit as to why we pulled youth athletics forward from phase 2 to begin this weekend on phase 1?
Yeah, thanks, Premier. So, case numbers are coming down quite dramatically, so that does give us confidence. Case numbers are 11 per 100,000, test positivity 5%. But again, I think not just sports, but all other things that we are able to do starting May 30th that we couldn't do. I think we just need to follow the guidance, be considerate of others, and do it as safely as possible. And there may really be some transmission events, but we want to keep that as rare as possible. And again, vaccinations are available now for 12 and older. So for children and adults who are older than 12, do get vaccinated. The first dose starts protecting you within 2 weeks, better after 3 weeks. Same goes for parents, friends, family, that, the higher our vaccine uptake, the safer all our activities are, including outdoor sports at this time. Thanks.
I would just add to that, Adam. We set a number of dates in the reopening plan and whatnot. Where we're able to maneuver those dates, the goal is to not leave these restrictions in indefinitely. The goal is actually quite the opposite, to remove these restrictions as quickly as we're able. Is there a priority with respect to which restrictions or measures might be looked at pulling forward or being removed given the current situation rather than others? And there was a question around household gatherings earlier. Yes, we were never happier to move on reducing the restrictions around access to our long-term care homes some time ago, to allow families to go in and visit their loved ones in long-term care homes. And I can say a close second to that certainly is for our youth to be able to not only practice in groups of 8 or whatever groups they were ultimately practicing in, but for them to actually have that competitive sports and be able to play have some competition in the sporting events that they have not been able to have for such a long period of time. And so this is a small step forward, but I would say it's a very, very significant step forward.
A follow-up probably for the Premier and Scott. Given that the importance of second doses and protecting the older populations, people have expressed some frustration over having to learn a new system to get booked through a pharmacy rather than the SHA because it's centralized at the SHA, and we're now vaccinating kids in schools, which is going to be, I think, obviously something we're really used to doing and the SHA is used to doing. So can we explain how we're going to make that as smooth as possible to get the second doses and make that process as simple as possible for seniors who have been waiting quite a while now for their second dose?
Scott, do you want to just talk a little bit as to our rollout and where it is and where it's going?
Sure. So Adam, as you already pointed out, with June coming next week and are starting to move through the schools and immunize 90,000 kids, which will be less, as we know, because we've already vaccinated 12,000 of them, and we'll do more this week. We're looking at more options, particularly on book clinics for SHA and walk-in clinics for our seniors that are more convenient. But also, as I said, sharing more information for pharmacy booked appointments that will take a larger component of the booked appointment for June. And then also the drive-throughs. I know the drive-throughs aren't that convenient for some of the, the 80 plus and the 85 plus, and that's why we're expanding our booked appointments at the SHA with our booking system, at least till the end of May and perhaps even into June, depending upon the number of kids that get vaccinated before we hit the schools. But we are still working through some of the logistics for our pharmacy colleagues and some of the folks in ISC that are helping support immunization across the province, with pharmacies in particular. We do have an extended time period now for the Pfizer vaccine, so it can be stored in an unfrozen state. We'll make it a lot easier for pharmacies to book appointments and then to book them out.
I would just add to that a little bit, Adam, with respect to the multiple spokes in the wheel with respect to vaccine delivery here, and how we have looked at this throughout. And credit to the Saskatchewan Health Authority and the Ministry of Health, and now the pharmacies being part of this conversation, and the education system, our school boards across the province, of constantly looking at what is working and what isn't working. How do we fix what isn't working, and how do we really enhance what is working? And if you remember back to the early days of the vaccine rollout, we were pretty sluggish out of the gate, and we very quickly through that process of focusing on what is working and trying to fix what isn't working, we were able to, for the most part, we've led the country in providing a very quick and rapid access to vaccines from corner to corner in this province, from our long-term care homes to the northern areas, as well as our urban centers and the very rural areas of our province. And a credit to all of our healthcare staff, but in particular our Saskatchewan Health Authority staff that have gone above and beyond over the course of the last number of months in this what I think is the most monumental and greatest vaccine effort that this province has ever seen, and they deserve full credit for everything that they have done to ensure that even at times where there's hiccups in the plan, they have been able to adjust and modify on the ground to ensure that yes, they're getting 6, sometimes not 5 doses out of a vial, and to ensure that they're making these vaccines accessible to everyone. The drive-thrus most certainly have been successful in the province, and I think we would say that is something that has worked and worked well, and you'll likely see as our vaccine deliveries continue to increased allocations to our drive-thrus. The Saskatchewan Health Authority clinics that we have and the booking system that we have has worked well, and I think there's a place for that to remain for maybe our elderly residents trying to access their second shot, maybe some of many of our rural communities accessing their second shot. There's also a place for our pharmacies, just by the sheer number and the access that people have to their local community pharmacy, and so we've been working very closely with the pharmacies, and we'll continue to work with them to ensure that we are always looking at, what is working well with the pharmacy rollout, and how can we continue to support the pharmacy rollout here in the province. And it's our true hope that and our expectation that as we move through the next number of months, that our pharmaceutical capacity will continue to build. These are retail businesses that we have ensured have had the opportunity to be open throughout this pandemic, not just their pharmacy area of their store, but in the case of large retail stores, their entire store has been able to be open for the most part throughout this pandemic. That isn't true across the nation. And we do need their ability to provide vaccines, which they show annually with the flu vaccination program. We need that capacity to provide vaccines through our pharmacy system in the weeks and in the next throughout the next couple of months. We have many Saskatchewan Health Authority employees that have gone above and beyond over the course of the past number of months, and sooner or later we're going to need to transition all of those employees back into offering the healthcare services that our healthcare system is there to provide. Our publicly funded healthcare system is there to provide Saskatchewan residents, and so we're going to continue to work with the pharmacies, and it's our hope that, and we know that many of our rural community pharmacies are working very hard to take care of their customers, and we want to make sure and ensure that we have the proper supports in place to ensure that even those large retail operations that do have a pharmacy attached to them, that they are using their capacity as well, understanding that they've been open for the great deal throughout this pandemic, that they are returning the favor to Saskatchewan people by using their capacity to deliver these vaccines throughout the next number of months as we get into our second dose strategy, ultimately providing us then with the opportunity to start to transition our healthcare employees back to providing healthcare services here in the province. We are going to get back to normal, and we best plan for it.
We'll take our next question on the line. Operator?
We have Zach Vicera with the Star Phoenix.
Hi there, Mr. Premier, Dr. Shahab and Scott. Thank you for taking my question. My first one is for Scott Livingston primarily. I'm wondering about some of our efforts to get vaccines to places that might be traditionally underserved. One thing I hear from a lot of people getting vaccinated is that they're often showing up early to a drive-through, waiting for a long time in line, signing up on multiple pharmacy booking sites, wait lists rather, and trying to get the first appointment they can. And it strikes me that this might be leaving out people who don't have hours to spend getting a vaccine or don't have, for example, internet access. What are some things we're trying to do to make sure that everyone has a fair chance to get the shot if they want it?
Well, great question, Zach. I'll just start by saying, throughout the vaccination program, we've used mobile clinics and pop-up clinics in many communities across the province, whether that's focusing on homeless shelters or seniors living independently, that we've identified through our home care staff, bringing the vaccine to them or to their community in many different ways is what we've been trying to focus on throughout. In some of those harder to reach remote communities, one of the things we did very early on, as you know, is prioritize those individuals first in our province, and we went to the far north first, both with respect to first and lowering age groups to make vaccine as available as possible. Some other examples, what we hope to see moving forward, and I would say, Zach, we haven't fully implemented what I would say would be a mop-up program for vaccination strategy because we're right in the middle of it. We're not finished first doses, we're just starting our second doses, but we do have lots of capacity as we hit some of those key numbers and high percentage of vaccination rates in the population where we can focus more of our resources on those specialty type clinics like the newcomers, like some of the things we've done with homeless shelters and also with some of the schools. With the school programs and even in the testing in the schools, we're not focusing just doing school hours. So in communities, we're going to allow families to come to the school to be vaccinated with their kids. So it's not just focusing on the kids, but really we're going to, the team has been told to examine any option to make vaccine available to Saskatchewan residents using any means possible. And we're, as I said, focused with our pharmacy colleagues and ISC colleagues and the colleagues at NIFA in sort of the middle of our primary program, but through more education and being more innovative with our clinics, we hope to get to more Saskatchewan residents as quickly as possible.
Follow-up, Zach?
Thank you. I do have a follow-up question there, and my follow-up is for Premier. Last week we learned that a public health order charge against full gospel outreach in Prince Albert stayed. I recall the gatherings that happened there in October of 2020 were linked to a number of COVID cases in many communities in Saskatchewan's north. It was cited as a source of many very severe community outbreaks. I understand you probably won't weigh in on a decision made by prosecutors, but I'm wondering, what do you say to somebody who sees that and thinks that the restriction, that the public health orders and that the penalties don't really have much weight?
Yeah, I won't speak too much to the specifics other than to say it's my understanding there was a number of charges that were laid in relation to that incident, and it's also my understanding that this stay of proceedings is in relation to one of those charges. That's about all I can say with respect to that. But you are correct with respect to the lingering effect that breaking the public health orders does have. Anytime there's a public health order that is broken, if someone has COVID at one of those events, there is the opportunity ultimately for, you know, a large degree of spread, which is what the public health orders are in place to prevent. And I'd said in my opening comments, if you think any politician, myself among them, is enjoying putting these public health orders in place, you're mistaken. No one does, and most particularly, no one looks forward to lifting the measures more than, in Saskatchewan's case, myself. And we are getting there. You know, to the earlier question as well, you know, our way out of this pandemic is through large amounts of people making the decision to get vaccinated, and we have put together the benchmarks of 70% of 40 and over, 30 and over, and ultimately 18 and over. And we're seeing very, very strong uptake from Saskatchewan people. When we achieved the phase 1 benchmark, 70% of those 40 and over receiving their vaccine, it's important for us to remember that the effort didn't end there. People continued to come out and get vaccinated to the point that today we're actually 76% of people 40 and over have received their vaccine here in Saskatchewan, and I would like to think that as we achieve now the 30 and over benchmark, that number will continue to increase in the days ahead, and ultimately when we achieve the 70% and over of 70% vaccination uptake of those 18 and over, that we will see you know, that continue to increase up to 75, ultimately 80, hopefully 85. I mean, the higher the better as far as keeping people safe here in the province. So the public health measures were in place to keep people safe. By and large, Saskatchewan people followed those public health measures. Where they didn't, there was charges that were laid. I won't dive into or offer my opinion as to you know, why Justice has you know, made the decisions around specific charges that they have. But I would close with thanking the vast majority of Saskatchewan people for the effort that they have made over the course of the past year, and that they continue to make right here today. When it's their turn, they're going out and getting vaccinated, and with us, everyone 12 and over being available for or eligible for a vaccine today, it's your turn.
We'll take another question on the line. Operator?
We have Allison Bamford with Global.
Hi there. We're hearing that Saskatchewan is in talks with Manitoba to accept some of its COVID ICU patients. If this is the case, can you confirm how many patients?
You know, fortunate at the moment with lower hospitalizations than what we have had, and fortunate to have some provincial capacity to offer our neighbors and fellow Canadians in Manitoba. Scott, maybe you can speak a little bit as to what the agreement entails and how we'll be moving forward day by day with Manitoba patients.
Sure, thanks, Premier. So Alison, one of the things that we're doing, as you know, throughout the pandemic is monitoring our hospital capacity and ICU capacity. We have been in discussions with our colleagues in Manitoba and helping them out. As you know, they're facing some unprecedented challenges with respect to both ICU patients and hospitalizations. So the teams have directly connected and will continue to connect on a daily basis. We're planning on using Saskatchewan Health Authority's provincial ICU capacity to support Manitoba. We'll do this in a slow and measured way, and starting, I believe, tomorrow, we'll accept our first patient from Manitoba. They will be sent to an ICU that's likely not Saskatoon or Regina, because as you know, we have capacity outside of that. And then the plan is to look on a day-by-day basis for the next 5 days to look at if we have the ability to support and transfer basically a patient a day. We are at this point in time setting an upper limit of 5 until we have a greater feeling on what the capacity needs for Saskatchewan will be and the implications, and have worked out things like transport protocols, and Manitoba is working on getting consent from families, etc., like they have for the patients that they've transferred to Ontario.
Follow up, Allison?
Yeah, is there any possibility, I guess, that this would impact patients here, having to shuffle them around or shuffle healthcare workers around at all?
Scott, maybe a little bit to our provincial capacity and how we've utilized that in the last number of weeks and months, and how we can continue to utilize it. And I think you spoke to where these transfers would actually go to, not necessarily in Saskatoon or Regina.
So just to add to that, Allison, we are that's one of the things we're carefully monitoring, but our ICU capacity is within the lower limit of our surge capacity. So we have been a lot higher provincially, both COVID and non-COVID patients. And certainly that's what why we're only accepting one patient today and then looking at what tomorrow brings to support our neighbors in Manitoba. It's important to know that if we were in the situation Manitoba was in, we would be reaching out to our partners interprovincially for that type of support. So we are doing so in a cautious way and collectively with our ICU teams across the province. So we wouldn't be transferring patients from Manitoba to a single ICU in Saskatoon or Regina. We'd be looking at the patient characteristics and ensuring that they can be properly cared for within the ICU capacity across the province.
I would just add, Allison, with respect, our hearts most certainly are with many families in Manitoba, and where we have capacity and where we can help, we most certainly are going to help our fellow Canadians in our neighboring province.
We'll take another question on the line. Operator?
We have Lara Fominov with 650 CKOM.
Hi, thank you so much for taking my questions. We're still seeing a couple of deaths, a few deaths from COVID every day, and many of those deaths are in people who are 60 and older. Do we know, are these people who have not been vaccinated? And is there anything you can tell us about why these people are dying when vaccine uptake for those older groups is so high?
Scott or Dr. Shahab, do you want to comment on that?
I can maybe make some initial comments and then Scott can add. So first of all, we did release our breakthrough case numbers where we found that less than 1% of our cases were in people who were 3 weeks out from the second dose. Having said that, that doesn't mean that they were zero. So 1% can be a significant number. And also, a very small number of people who were vaccinated had other serious comorbidities, were older, and ended up in hospital. We also had people who were admitted for a long period of time and ultimately passed away. But the vast majority of cases continue to be individuals, especially the newer hospitalizations, continue to be individuals who either were not vaccinated or where COVID was one of the causes in situations where there were many other comorbidities. But certainly this is an analysis which we are continuing to refine and can bring back certain further numbers. But again, I'll just reemphasize that the vaccines are performing exactly as the study showed. They are dramatically reducing hospitalization and death. But still, there will be a small number where unfortunately the vaccines will not be fully protective, even for severe outcomes, and a greater number who may have mild illness. And finally, I would say that is exactly why it's very important to be vaccinated to protect yourself. But if all of us are vaccinated, we can also protect others who may be vaccinated but may not mount a full immune response due to other underlying health conditions or immune suppression. And I'll stop and maybe ask Scott to speak further.
So the only thing I would add, Laura, is as the Premier's outlined and Dr. Shahab has outlined, the majority of our hospitalization today are in individuals that did not receive vaccine that were eligible to receive. But I can't speak to why, in fact, they might not be vaccinated. They may have some reason or condition that prohibited them from doing so. Or to Dr. Shahab's point, they may have had other comorbidities that led to their hospitalization beyond just COVID. But certainly getting vaccinated, as you know, is our most definitive tool to reduce pressure on our healthcare system, as well as reduce our infections across the province.
Here and where this is where Lara, this is where things change now. Up until now, when you look at reasons for people to not be vaccinated, and ultimately the vast majority, if not all of our fatalities are people that have not been vaccinated for some reason, and virtually all of our hospitalizations as well. But they may have an additional condition that prevents them from receiving a vaccine. May not have been eligible up until this point. We may not have had access for a vaccine for their age group, or not had access in their community, and they may have gotten COVID and still had that ultimately today. Or it may have been a choice that someone has made, is in that they just simply are not going to get vaccinated. I mean, that's where we've been up until now. Where we are going from here on with the elevated numbers of vaccines, and now we're open to eligibility to everyone that is 12 years and older. There is a small minority of the population that may have a condition that prevents them from receiving a vaccine, and there are people that are in that category. And then there's choice. There's personal choice. And I had outlined in my opening comments some of the risks that come with that personal choice of not choosing not to receive a vaccine. You stand a greater degree of not only getting COVID, but getting quite sick from COVID. You stand at greater risk to being hospitalized due to your choice. Should you contract COVID, COVID is not going away, and ultimately you stand a much greater risk of ultimately having COVID have fatal consequences for you. So that is why we should all consider very seriously the choice that each of us have in accessing this vaccine. We've always said it's there to keep ourselves and keep those around us safe. As we move forward with reopening our communities, COVID is not going away. It is going to continue to circulate, most potentially in those that are not vaccinated. And now I'm asking you to consider getting vaccinated to keep yourself safe.
Follow up, Laura?
Yes, and I guess, Premier Moe, that would lead me to my next question. If there is a point where most age groups have plateaued and there's still a portion of the population that is resistant to getting a vaccine or simply won't get a vaccine, has there been any consideration given to handing out any sort of incentives like they do in the U.S., monetary or prizes or things like that they've done to increase vaccine uptake in the U.S.?
No, for a few reasons. One, I remain convinced and hopeful that Saskatchewan uptake is going to be very strong, like it has been and continues to be even through the younger age groups in the early days. So I am very convinced and quite hopeful that our vaccine uptake will be among some of the highest ultimately in the nation. Second, the incentive is that should you get COVID, vaccinated versus an unvaccinated person, you're not going to get as sick if you're vaccinated. You're likely not going to end up in the hospital. We have 136 people in the hospital today. Virtually all of them have not received a vaccine. And when it comes to the most severe outcome of COVID, the fatalities that we've experienced in this province are also people that have ultimately not been vaccinated. So the incentive is you don't get as sick and you put yourself at much greater risk of a positive outcome should you contract COVID here in Saskatchewan. We're going to move forward with reopening our communities, and we're going to move forward with getting back to normal in our communities across this province. COVID is going to be there, and if you choose to not be vaccinated, you're putting yourself at some great risk, and you should be aware of what those consequences could and may be.
We'll take our final question on the line. Operator?
We have Julia Peterson with the Canadian Press.
Yes, hello. My question is, have you heard of any instances of people trying to get their second vaccination before they are eligible to do so?
I'm sure they're out there. Our goal is to get everyone a second vaccine by sometime in July, as quickly as possible. We've obviously prioritized certain segments of our population, as we discussed earlier, those that received an AstraZeneca shot in the first 15,000 that came into the drive-through here in Regina are approaching their 12-week time frame, as well as our elderly folks that were very first in the queues for Pfizer and Moderna. And so we are prioritizing it for those reasons. I'm sure there's some folks that have attempted to get their second shot earlier or out of the queue, just like we had ultimately in Canada and around the world, people attempting the same with their first shot. But I don't think it's been a point of note or contention, has it, Scott?
No, Premier, not that I'm aware of any specific examples of somebody intentionally queue jumping. Certainly, we've been fielding lots of questions from the public around our and when they're eligible. That's why last week we did release the chart with the timeframes around second dose eligibility as we moved into the 80 pluses this week. Not to say that it hasn't happened, but it certainly hasn't become an issue. And it was, I would say, similar as we started with our most vulnerable. Saskatchewan people were patiently following public health orders, waiting for those people at most risk to get their vaccines first. And we see that continuing to happen.
Do you have a follow-up, Julia?
No, thank you.
That concludes today's update. Thank you for joining us.